Mrs. Jones. I'm Katie. I'm going to be your nurse today. So I understand you're going home, so I'm going to go over some of your medications with you.
Okay.
This is a patient handout on furosemide, so you can just follow along as I go over some of the information.
Okay.
Do you know anything about that medication?
I've heard about it, but I don't know any of the information about it. So I'm glad we're going over it before I leave.
Yeah, exactly. Well, it's a diuretic. So do you know why you were hospitalized?
For heart failure.
Exactly. So one thing with heart failure is you can get kind of fluid overload, so a diuretic is going to pull some of that fluid away to make it easier on your heart.
Okay.
And your doctor also prescribed, it looks like lisinopril and metoprolol, which are other drugs that are typically prescribed for heart failure. So you'll want to take those in combination.
Okay.
And I see you're also on lotorvastatin. Do you have a history of high cholesterol?
Yes, I do.
Okay. All right. Are you aware of any allergies that you might have?
Nope.
Okay. And do you have any history of diabetes or blood pressure issues?
Nope.
Liver or kidney disease?
Nope.
Okay, good. Because those would be things you'd be concerned about with this medication. So your doctor prescribed 20 milligrams
Okay.
once a day. It's just an oral tablet that you'll want to take with a full glass of water. And you can take it with food if you need to, though. It starts working in about an hour, so you'll start noticing quite a bit of an increase in urine output at that time. And it can last up to 8 hours, so it's best to take it in the morning.
Okay.
Because you don't want to be getting up at all hours in the night going to the bathroom.
Okay.
So some side effects you might experience would be like nausea, constipation, dizziness, low blood pressure. It can also lower your potassium levels. You might get heartburn or dry mouth. Some things that you'll want to report that are signs of more serious complications would be weakness or tingling, numbness in your extremities, which could be a sign that you have low potassium.
Okay.
And also, if you have heart palpitations, that can be a sign that your potassium levels are getting too low. If you have any difficulty breathing, you'll want to report that, as well as any kind of severe abdominal pain or bleeding, and any kind of rash, because it might be an allergic reaction or it could be something even more serious than that.
Okay.
So you'll definitely want to report those conditions to your doctor.
Okay.
And if you suddenly aren't putting out any urine, that could also be a sign of serious problem.
Okay.
So before you start taking any other medications, you'll want to let your doctor know, because sometimes those medications can either increase or decrease the effects of furosemide.
Okay.
And also before you become pregnant or plan on becoming pregnant, or if you discover you are pregnant, you'll want to tell your doctor about that too, because it's not the best thing to take while you're pregnant.
Okay.
So since this does lower your potassium, you want to be sure to get plenty of potassium in your diet. Some good foods would be like potatoes, green vegetables, apricots, bananas, things like that. And your doctor will want to monitor your blood work periodically, just to make sure your liver and kidneys are working okay, and also make sure your potassium levels staying up.
Okay.
If you forget a dose, you don't want to double it, because this does lower your blood pressure quite a bit since you're pulling off fluid. And it can make you feel really dizzy when you're changing positions. So before you stand up, if you're sitting down, you want to maybe dangle your legs a little bit. Make sure that you're feeling pretty stable before you stand up, because we don't want you falling over.
Okay.
It might also be a good idea to check your weight every day at home. Daily weight is a good way to check your fluid status, make sure you're not retaining a lot of fluid, and make sure that the medication's working like it's supposed to.
Okay.
You'll want to tell your doctor if you have more than a 2-pound difference in a day, because that's a sign that you're either you lost all your fluid or you're having way too much fluid.
Okay.
And if you happen to have a blood pressure cuff or want to buy one, it might be good to check your blood pressure at home just to make sure it's not getting too low. And if you do have consistently low blood pressure, it might be good to talk to your doctor about maybe adjusting your medications, since
Okay.
the other medications you're on can also lower your blood pressure.
Okay.
All right, so why are you going to be taking this medication?
For heart failure.
Exactly. And when are you going to take it?
In the morning.
Okay. And how much are you taking?
20 milligrams, and you told me to take it with a glass of water or with food.
Yep, exactly. And what are you going to report to your doctor?
If I have like a rash for an allergic reaction, if I have any muscle pain or tingling, if I have any severe abdominal pain, and if I have like any abnormal rhythms in my heart.
Exactly, very good. Do you have any other questions for me?
Sometimes I forget if I've taken a medicine or not, so do you have anything that would maybe make that easier for me so I don't forget.
Yeah, a good thing to do would be to get a pill organizer. You know those things that have all the days of the week, and you can just put each day's medication in there. Since you have multiple medications you have to take each day.
Okay.
So that's a good way to do it. And then also, if you want to just get like an alarm on your phone or something like that, sometimes that can really help people.
Okay.
Yeah.
And then, do you know how long I'm going to be taking this medicine?
I am not sure on that, but I will go check with your doctor and I will get back to you. And I will go do that, and then we can talk about your other medications.
Okay.
Sound
Thank
good?
you.